Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Melissa Horitzik. We have a lot of information to keep you and your loved ones healthy coming up in this episode, including what may be causing your child's cough. A February's pediatrician has some insight into possible conditions that you want to know about. This Zellwood man is on the road to recovery thanks to a local cardiac team that has plenty of practice. And you'll get a history lesson on the start of the movement to promote a healthy lifestyle. There's a Central Florida connection. Our first story highlights new state-of-the-art equipment for cancer treatment. This new TrueBeam linear accelerator is designed for more accurate treatment of cancer patients.
The linear accelerator is a machine that produces high-energy X-rays to deliver radiation treatments. In radiation oncology, every step we can do to make the treatments more accurate will reduce the radiation to the surrounding tissues and ultimately reduce side effects to the patient.
Dr. Jane says advanced technology allows him to create a treatment plan for each individual patient.
We have historical standards, and in our field there's always studies to improve upon outcomes. And as a physician, part of our responsibility is to continue to stay up to date on those studies. We take information from those studies and those standards, we apply it to every individual's patient and condition. We work along with their other physicians, other surgical specialists, medical oncologists, to come up with the best treatment plan for that patient. With some of the features with the machine and the increased dose rate, many of our treatments can be delivered in a shorter time period than previously. With this technology, this continues Waterman Cancer Institute's commitment to having the most advanced care to our patients in Lake County.
A cancer diagnosis can be overwhelming for anyone, even those who have experience with the disease. But a program available in Lake County is designed to help patients and their families through the process.
It was a year ago, December, like I was saying, between my birthday and Christmas. I was doing a self-exam and thinking what my mom went through and stuff. I came right here to the Cancer Institute, and Miss Eileen is the first person I saw.
After finding a lump, Ann Murphy of Altoona sought help from Eileen Bascom, a cancer care navigator at Florida Hospital Waterman's Cancer Institute.
A cancer care navigator helps guide a patient through the health care process. I can help with the process of patients going to see their physicians, with the different care providers that are going to be providing their care, and physicians that will be working together as a team. My work is to help ease that communication and make that process easier for patients, to help with education, to anticipate some of the things that may be a little bit more complicated for patients to understand.
Here at our institution, we have the state-of-the-art form of treating patients with cancer, from screening mechanisms to the actual diagnostic imaging to the wonderful physicians who are here capable of taking care of if it's a surgical need, if it's a chemotherapy need, if it is a radiation need.
Since her diagnosis, Murphy has had chemotherapy treatment, surgery, and radiation treatment. She says the cancer care navigators provided tremendous support and encouraged her to join the cancer support group.
Miss Eileen did a lot of the paperwork and doctors and stuff like that. And Miss Georgianne was like medical questions and about the medicines. They helped a lot on anything financial, if I had questions on that. And right away, Miss Eileen helped me with my insurance. And then they got me started with the group.
You can learn more about the advanced technology and invaluable resources available to cancer patients in Lake County by visiting fhwatermancancer.com. Next, we turn our attention to Heart Month and share a local man's incredible story about his journey back to health.
On Friday morning, August 19th, we had some friends come over and stay the night, so I was fixing breakfast when I suddenly felt dizziness. I went and sat down and started to have an upset stomach. And then when I started to sweat, my wife said, it looks like you're having a heart attack or so. And I said, I feel it, so don't take me to the doctor, take me to the hospital.
Mitchell was taken by ambulance to Florida Hospital Waterman, where cardiothoracic surgeon Gary Allen soon gave him the diagnosis.
He basically said that 3 of your arteries are either fully blocked or nearly fully blocked, and that there would be surgery on that coming Monday, which is what happened, a triple bypass.
Incredibly, just 2 weeks earlier, Mitchell had vacationed in South America.
We went all over Peru, walking and climbing up to 14,000 feet at one point, and I got to Machu Picchu and climbed all the way up to the top of that, and felt winded, but then that's altitude kind of situation. Of course you're nervous because it's open heart surgery, but I felt like it's something that had to be done, and I've heard good things about the doctor before.
One of the neat things about cardiac surgery is that it's very objectified. By the time the patient gets to the operating room, we've measured the issue with the valve, the issue with the arteries. We can quote percentages and which arteries and which locations. And because we've done so many, and I've done well over 3,000, maybe 4,000 heart operations at this point, you can speak from a great wealth of experience of this is how it goes within usual limits. We really enjoy the benefits of the recovery of those patients. It's not uncommon right after surgery to have the breathing tube removed, which is really a pretty novel thing in heart surgery, where in many programs it takes about 6 hours afterwards.
After the procedure, Dr. Allen referred Mr. Mitchell to cardiac rehab at Florida Hospital Waterman, where he focused on regaining strength and stamina.
My wife and I are celebrating in May our 50th, so we're going to Hawaii for a month.
You can learn more about the Chest Pain Accredited Heart Center at Florida Hospital Waterman by visiting the website fhwatermanheart.com. Next, blue lines and bulges on one's legs can be more than an unsightly problem. Doctors warn that ignoring vein disease can lead to other complications.
Vein disease is a disease that a lot of people have sort of learned to ignore, but vein disease can have a significant amount of morbidity to it. The progression of vein disease, if left untreated and if severe enough, is that you can get ulcers, skin breakdown, and things like that, which can be, again, very debilitating, very time-consuming, slow to heal.
Dr. Sebi says vein disease is more symptomatic in women, but men also suffer from the bluish-purple lines. And if you're young with unsightly veins on your legs, she says you can blame your family. Vein disease is often genetic.
The components that contribute to vein disease are also multiple, just like every other disease. A big one is lifestyle. By lifestyle, I mean occupation and lifestyle. So a sedentary lifestyle, an occupation where you're standing on your feet for a long time. I always joke that vein disease is a disease of the hairdresser, the waiter, the nurse, and the doctor. So basically, anybody that stands on their feet for a long period of time puts excess stress on their veins and therefore has a tendency to vein disease.
You'll find a specialist who can tell you about minimally invasive options to treat vein disease by visiting the website on your screen. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. Is your child coughing the result of a cold or something chronic? When we come back, a local pediatrician will have helpful insight. When did the medical movement, which promotes healthy lifestyle for prevention, begin? Stay tuned for a history lesson. It includes a Central Florida connection. And we'll visit the Con Recreation Health Center kitchen, where Chef Dave's twist on oatmeal will make you want more. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery. And you'll also find a listing of the specialists featured in this month's episode. First, here are some events that you and your family might want to check out. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Melissa Hritzik. We turn our attention to children and some help during the cold and flu season. specifically what to do about your child's cough. For some parents, it can be difficult to know when a cough is a sign of something more serious than a cold.
I would say certainly in the fall and winter, that's by far the most common presenting symptom that we have is cough, congestion of the nose. We see these symptoms very regularly. Often they're just due to very acute, short-lived illnesses, primarily infections of the lungs. Viruses often do this. But when you see a pattern of recurrence, they're coming in very regularly every few weeks and the symptoms aren't getting better, then we have to look for chronic conditions. And so the main one we always worry about is asthma. And asthma can present with repeated episodes of difficulty breathing, coughing fits, and wheezing. Often you may just have a chronic cough that never ever goes away.
Dr. Diaz says some seemingly unrelated symptoms can be a clue to a child having a more serious condition.
Eczema is a skin disorder that comes with dry skin, itchy skin that can get crusty and sometimes gets infected. There is an allergic component to eczema, and so when you see eczema, children are at risk for other allergic disorders, and that can include asthma. So when I see a child who has a history of eczema and now they're in my office and they're wheezing, they're having difficulty breathing, they're coughing, certainly you have to think of certain things, but the main thing I'm thinking about, could this child have early asthma?
Dr. Diaz advises parents to follow their instinct if it seems something is wrong with a child.
If you're concerned about how they look, how they're breathing, how they're eating, don't hesitate to get someone to evaluate your child.
You can find a specialist to assist with your entire family's medical needs by visiting the website on your screen. You won't likely hear a nutrition expert advising you to have dessert for breakfast. But Chef Dave is in the Con Recreation Health Center kitchen with a meal that will start your day with delicious yet healthy sweetness. Our Focus on Heart Month has us turn to the most important meal of the day, breakfast. And today we have Florida Hospital Waterman Executive Chef David Atkinson and registered dietitian Peter Weiss to share a delicious recipe with us. Peter, do you want to tell us a little bit about this recipe?
Sure, Alyssa. Well, we're going to be doing a banana bread oatmeal recipe, and the key ingredient with that recipe is going to be the oats, which are beneficial for cholesterol levels. But we do have other ingredients as well, such as skim milk, low-fat yogurt, as well as pecans, which are also beneficial for cholesterol levels.
Sounds delicious. Can we go ahead and get started, Dave?
Sure. I already have the milk hot here. So we're just going to stir in our oats. And these are quick oats, but you could use steel cut oats or, old-fashioned oats. Any kind of oats will work. And we have some seasonings, a little bit of cinnamon, some brown sugar. You could use alternative sweeteners as well. You could use maple syrup or stevia, honey, any of those type of things.
And if you happen to have any sort of milk intolerance, you could also use soy milk as well as an almond milk as an alternative for the milk product.
And I'm going to add half our nuts, which are chopped pecans. And we're just going to let this simmer for a few minutes while I mash up the banana.
The bananas are going to provide a nice alternate texture to the oatmeal and the pecans. But if you don't happen to like bananas, you can always go with something like blueberries, strawberries, any kind of other fruit really that's something soft and similar in texture.
So we'll just put our mashed bananas in there.
Now this you don't actually bring to a boil, you're just letting it warm.
Yeah, I'm gonna actually simmer it for just a couple minutes so it absorbs some of the milk. It gets a little bit thick. It's gonna take about 3 minutes. So we'll pour a little bit in our bowl. And then for a little garnish, we'll do some low-fat yogurt, a few sliced bananas, and the rest of our pecans.
Beautiful.
It's our banana bread.
That looks delicious.
Oatmeal.
It does, thank you. If you'd like this banana bread oatmeal recipe, go to watermanwellness.com. This year marks an important medical milestone for Florida Hospital Waterman and its parent company, Adventist Health System. September is the 150th anniversary of the Western Health Reform Institute, the first chapter in a long legacy of health and healing. Next, Waterman Wellness offers a health history lesson in this video provided by Adventist Health Systems.
Across America, from the mountain states to the Midwest, from the East and South, in sleepy towns and bustling cities, the work of Adventist Health System is defined by a unifying thread that winds through more than 150 years of a health and healing legacy. In the mid-1800s, health and long lives were rare. Good health care was practically non-existent, and doctors often prescribed odd elixirs and treatments, some of which were as harmful as the diseases they promised to cure. People were afraid of night air, and bloodletting was still a common practice. But several founders of the newly organized Seventh-day Adventist Christian Church had a better idea. They believed God had already provided the best remedies in nature, and they turned their attention to prevention, suggesting that fresh air, sunshine, rest, exercise, nutritious food, and clean water could help people stay healthier. They also proposed that a simple diet rich in nutritious foods would help build stamina and strength. Health reformers, led by James and Ellen White and other early Seventh-day Adventists, looked at the life of Jesus Christ and wanted to follow in his ways, caring for those who were hurting, physically, emotionally, and spiritually. With this mission in mind, these pioneers launched the Western Health Reform Institute in Battle Creek, Michigan on September 5, 1866. They had limited staff, an 8-room house, and just one patient. They also had more faith than medical know-how, but they were determined to follow the Creator's footsteps. Pooling their resources, the church members managed to put several students through medical school. One was 23-year-old John Harvey Kellogg, who became medical director of the Institute in 1876 and changed its name to the Battle Creek Sanitarium. Dr. Kellogg was an avid reader who traveled the world to increase his medical knowledge and improve the work of the sanitarium. He was also a prolific inventor, developing procedures, surgical techniques, and medical equipment, much of which influenced the medical care we know today. In an effort to provide an easy and nourishing option to the typical unhealthy breakfast of that time, Kellogg ground corn and formed it into ready-to-eat flakes. His brother, who worked with him, later started the cereal company that still carries the family name today. Dr. Kellogg's expertise and innovations were widely known, and in the late 1800s through the early 1900s, the Battle Creek Sanitarium drew patients from around the world. Some of the most famous of these were John D. Rockefeller of Standard Oil, department store founder J.C. Penney, inventor Thomas Edison, African-American educator and author Booker T. Washington, and aviator Amelia Earhart. William Howard Taft, the 27th President of the United States, was the 100,000th patient of Dr. Kellogg and the Battle Creek Sanitarium. On a cold winter night in 1902, as Kellogg was out of town, the Battle Creek Sanitarium caught fire and burned to the ground. Undeterred by the disheartening news, Kellogg immediately boarded a train for Battle Creek. By the time he arrived, he had already sketched out plans for building a new and even grander sanitarium. This began an era of rapid development of like-minded institutions all over the country. Boulder Sanitarium in 1893, Hinsdale Sanitarium in 1905, and in that same year in Southern California, an abandoned hotel was purchased and Loma Linda Sanitarium was opened for care and medical education. Today, Loma Linda University Health ranks as one of the top-rated medical schools in the country. In 1908, Florida Sanitarium in Orlando was founded in faith by a small group of church members, including one person who mortgaged his own home for the down payment. Today, Adventist Health System employees, diverse in culture and backgrounds, find opportunities to provide highly advanced levels of care in a Christ-centered environment that encourages the health and healing of the whole person. Adventist Health System hospitals, outpatient centers, and nursing homes extend the healing ministry of Christ as far north as Wisconsin, as far west as Colorado, and as far south as Texas and Florida. Adventist Health System, reaching out, touching hearts, healing lives.
You can learn more about the Adventist Health System's Legacy Celebration by visiting watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the March episode right here on Lake Sumter TV for some of the following stories. You'll learn about a disease that affects blood vessels and learn how local experts are helping patients. A local specialist explains how laparoscopic procedures are helping patients recover better from colorectal surgery. And Chef Dave will be back with a pasta recipe that is good for your digestive system. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Melissa Hritzik for the award-winning Waterman Wellness.